So we're looking at the next type of muscle conditions. So for the next type of muscle conditions, we look at congenital myopathies. All right, congenital myopathies. So looking at these congenital myopathies is quite, it's something that I can actually understand a lot by just trying to define what is congenital and what is myopathy. So when you say congenital, to me, my understanding of congenital is anything that you were born with. Okay, so myopathies is muscle diseases or muscle conditions. So congenital myopathy just simply means somebody was born with a muscle condition, right? So define it, talk about the symptoms, and talk about the types of these muscle conditions that you can be born with. So there are a group of rare inherited muscle disorders. They are typically present at birth, or they come up early as a child is growing. You understand? So unlike muscle dystrophies, those conditions are usually non-progressive, or they slowly progress. Do you understand? Like, they don't really go from bad to worse so fast. Do you understand? So key features: onset is present at birth or early childhood. Okay. So hypotonia, you see that the baby is very weak. Okay. Can you see that this baby is weak? They call that a floppy baby syndrome. Okay. Delayed motor milestones, facial weakness, high arched palate, respiratory difficulties, skeletal deformities. All of these are things that you pick up on these diseases. So looking at the types, we have things like the Nemaline Myopathy. So I'll just be calling the name. You can pause to look at the genetic cause, the histological hallmark, and some notes. So this is a picture of the Nemaline Myopathy, right? The next, we have the central core disease, which is what you have on the screen here. Okay. Then we have the central nuclear myopathy. All right. So then we also have the multi-mini core disease. We have the congenital fiber type disproportion. Okay. So if you want to pick up these things on diagnosis, you have to clinically evaluate. All right. Can do muscle biopsy, can do genetic testings, can do electromyography. All right. So management, something that you're actually born with. To cure it to be quite hard, right? But you can just be doing anything that will improve the life quality of the person. If they are having difficulties in breathing, you can assist with respiration. If they are having difficulties with eating, you can also assist with their nutrition and all of that.